Coughs, colds and annoying sniffles abound at this time of year, along with common claims that people have developed the flu. In actual fact, flu is a completely different phenomenon and much more serious than a cold.
Well, flu is a virus which people pick up, and it gives them general symptoms that can range from anything like a simple cold, simple head cold, right through to feeling awful, being laid up in bed with muscle aches and pains. In severe circumstances it can cause bronchitis or pneumonia, and very occasionally in the elderly and infirm or people with underlying chronic illness it can cause death. In general, flu-like symptoms are what people present to the doctor with quite frequently. These would be snuffly nose, sore throat, headaches or aching pains in the muscles or joints. If you're worried, consult your doctor. Most cold-like symptoms, simple viruses causing the cold, would resolve in a few days to a few weeks. Flu-like symptoms tend to get worse over several days and make you feel pretty awful and want to lie up in bed and not do anything. Anybody who's over the age of 65 is eligible for a flu jab, and also anybody with a chronic disease, so people under the age of 65 included. The chronic disease would be things like heart problems, respiratory problems such as bronchitis, emphysema or asthma, or people who've had a stroke or who have diabetes. There are many other conditions for which you'd be eligible for a flu jab. So if you have a long-term illness that you've been treated for by your doctor, and you're not sure, then contact your surgery and they will let you know whether you're eligible for a flu jab. Here at the surgery we do a number of ways to get your flu jab. If you're coming for a routine consultation, either with the doctor or the nurse, ask about it, and it will usually be possible to give it there and then. Otherwise, if you're not planning to attend the doctors for any other reason, then ring up and make an appointment, and one of the practice nurses will give the jab. It's a very quick process. It just takes a couple of seconds, and it involves an injection into the upper arm. It's important that you don't have the flu jab if you're ill at the time. So if you've got an illness, either a cough or a cold, you're feeling under the weather in any way, then ask the advice of the professional that you're seeing, and they'll tell you whether you should have it or not.
I've had flu before, and quite frankly it's horrible. You know it's flu because you're aching all over. You seem to have a pain in the middle of your head, and you just say, I'm going to bed. I've had the flu jab on a regular basis ever since I was over 65, so yes, I've had it quite frequently, and I would recommend it to anybody. It works for me. The actual jab is nothing. It's a little bit of discomfort. There are a lot of people unsure, but it's absolutely painless. It's something you need to do to protect yourself. You know, it makes sense.
We should encourage people to come for the flu jab because it's a very effective vaccine. It helps to prevent patients getting true-blown influenza, which if you do get it, that is an awful condition. You're actually in bed, aching from top to toe, you're sweating, you feel generally ill, and some people can be in bed for up to sometimes 5 to 7 days. There are a lot of misconceptions about the flu jab because of the time of the year that the vaccine's given. There are lots of coughs and colds around, and when people have the flu vaccine, they may suffer with a cough or a cold a couple of days later. That isn't an effective vaccine. The vaccine does not give you influenza. It protects you against influenza, and the difference being that you will still get coughs and colds, but you won't get true-blown influenza. So the vaccine will not stop you getting runny noses and coughs, but it will hopefully stop you going to bed for a week and being sweaty, have headaches and feel generally unwell. That's the difference with influenza, which is what we're protecting against. Flu can be very serious, and you know, there are some times when people have died from the flu. You know, there have been deaths from flu, so you know it does have serious consequences.
Last year, almost 3/4 of the eligible population in Darlington had the flu jab and got through the winter safely and feeling well. Doctors' surgeries in Darlington are receiving stocks of vaccine now. If you are over 65 or have a long-term condition, keep yourself safe and make an appointment today to have your flu jab.